Well, exposure to trauma, which would be part of the emotional aspect, but some of the side effects of exposure to trauma, such as lack of attention, poor memory, concentration, cognitive dulling. You have, what happens when you don't sleep that well? Well, yeah, if you go a long time without sleep, you might hallucinate. But in general, if you don't, what happens to you if you only get 4 or 5 hours for a few nights? You're not as sharp as generally as you would be. And then the emotional stressors, being lonely, being separated from loved ones, depression, anxiety, watching friends get injured, all the stuff that comes along, the emotional stuff that comes along with being separated from family, and potentially being injured, fear, and then seeing potentially colleagues, comrades being injured or killed. So there are a lot of different stressors, so it's just not being shot at, that stressors that combat, that service members deal with. Which leads me to the concept of combat and operational stress. Have you guys ever heard of this, combat and operational stress? So really what it is, it's just a way to identify someone who is having a normal reaction to an abnormal situation. So it's a transient stress reaction. It's not acute stress disorder. It's not PTSD. It's what every one of us would probably experience if you dropped us 12,000 miles away in a combat zone and put a rifle in our hands. You're going to experience a variety of different stressors. And it's important not to pathologize that, because we would all have the certain issues. We would all have loneliness. We would all be afraid at times. That doesn't mean we have some formal psychiatric diagnosis. And the good thing about combat and operational stress reactions is that they are transient and they go away after a while. But many service members have multiple combat stress reactions. That can potentially lead to PTSD or more severe psychiatric disorders, but in most cases it doesn't.